Cleft lip is a congenital, means disorder happening from birth. What happens is when our face is developing, there are three components which join together when the baby is in the uterus. So there is one component which comes from this side, one from this side, and one from the midline. Many a times, one side or both the sides fail to fuse. Like in me, all these three components fused when I was in my mother's uterus. And so I have a complete face. But instead, if the left side did not fuse, there will be a gap here. Or both sides don't fuse, there will be two gaps on two sides. So basically, cleft lip is a ununited lip. There are no, there is no particular reason why a baby has cleft lip. Some parents who themselves have cleft lip have a slightly higher incidence of their baby having cleft lip. Meaning, if the normal incidence of cleft lip is 1 in 3,000 mothers, it increases to 1 in 1,000 in a parent who has cleft lip. But there are no reasons to it. When a baby is born with cleft lip, it is a devastation for the parents. So they have to be counseled and reassured that this is a condition which can be treated very well. You can make a cleft-free individual from starting from cleft lip. Now, one problem that they have immediately is inability to suck milk sufficient in amount, because suckling needs this pursing action. Now, this pursing action of our lips is absent because the lip is not united. They have to be given a bottle whose nipple has a bigger hole. Or if the mother is feeding them, she has to feed them at more regular intervals. Frequency needs to be more so that they get sufficient milk and their stomach is full. Comprehensive management of cleft lip involves many more problems. Like sometimes cleft lip is associated with cleft palate. So whether cleft palate exists or not, whether it is a complete cleft lip or an incomplete cleft lip, whether there is a nasal deformity or not. Based on all this, we guide them as to how this baby is going to go through during their childhood. As far as feeding is concerned, you can feed them with a spoon. Many babies take to spoon feeding so well that they don't need a bottle, or they don't need to take mother's milk if it tires them out. See, if sufficient suction force is not there in these babies, then they get tired early. A normal baby would suckle and get enough milk. But this baby with cleft will tire out within a few minutes. And they would not have sucked sufficient milk. In which case, we ask the mother to extract milk using an extracting device and feed that milk with a spoon. The other aspect is there is something called orthodontic treatment, meaning something like taping the lip together. My treatment is led by plastic surgeon. There are other specialties who come into picture at various ages. Like we mentioned, speech therapists, like pediatricians, sometimes ENT surgeons, when their ear starts secreting some fluid. Some of these babies have that problem. So they come into picture. If their teeth are wrongly placed, there is a specialist called orthodontist who comes into picture. And sometimes, or it should be done more often than not, a child psychologist should be brought into picture, because sometimes these children get taunts from their peers, from their friends, which need to be attended to, and they need to be psychologically counseled. speech problems are not associated with cleft lip. They are associated with cleft palate. So many a times, cleft lip and cleft palate are combined together in a baby. What happens in cleft palate is there is escape of air through the nasal cavity. Like when we are talking, the oral cavity and the nasal cavity, they get separated from each other. And so our speech is so clear. Even if a small amount of air escapes through the nasal cavity, the speech changes. If the escape is very small, then there is just nasality in the voice. You must have heard many singers who have a nasal twang. So that amount of nasal twang is fine. But when the words become incomprehensible, they cannot be understood by a stranger, then that becomes a disability. So in this case, we ask them to go for speech therapy. There are specific ages which are best to do cleft lip surgery. Like the lip repair is done between 3 months to 6 months of age. The surgery is done under general anesthesia, and the stitches that are given are either dissolvable. If they have to be removed, they are removed after 7 days. It takes 3 weeks for the wound to become strong enough, after which we ask them to massage the scar with a massaging gel. It takes about 3 months for the baby to be fully fine. But you look at them after 2 or 3 weeks, then also they are absolutely happy and pain free. So it doesn't take too long for them to recover from the surgery.